Hi, Health 425. My name is Trenton, and I'm here to talk to you about trauma-informed care. If you remember back to our second On Your Own lesson that we did a couple weeks ago, you might recall that we briefly covered trauma-informed care as part of it. So I'll try to refresh your memory and expand on your understanding of this framework. Unfortunately, we don't have time to cover everything, so I will really only be focusing on the topics that I have bolded on this abbreviated list. And when you look at my abbreviated list here, you might notice that a lot of these things might seem like really logical and even common sense. In many ways, you would be correct if you had that assumption. But there are also a lot more details that go into each of these things, and they can be a little bit more nuanced. That's not quite visible on the surface. So this brings us to our first point. Trauma-informed care, it refers to emotional trauma, not physical trauma. This is actually an important distinction to make because most healthcare providers, especially in the emergency medical setting, often think of physical injury when they hear the word trauma. So, what is trauma informed care? Well, it is an organizational structure and framework for treatment. While this sounds complex at first, what it really means is that it is system wide and it is provided by healthcare workers at all levels of the system, and it is part of the treatment plan. So, from the time you walk in the doors of the facility to the time you leave, every provider you interact with should have the same level of understanding and training of trauma informed care. Obviously, there's a little bit more to it than this, but this is good enough for our basic understanding. An unfortunate truth about life is that actions with good intentions don't always have good outcomes. This is especially true when it comes to traumatized individuals. And unfortunately, large number of well-intentioned people try to help their traumatized loved ones and instead make the issue worse, which is the last thing anyone wants. This is also concerning when a provider does this mistakenly while trying to render aid or performing a procedure while the patient is in a very vulnerable position. Not realizing it is reminding the patient of past trauma. Trauma-informed care can also play a large role in improving the diagnosis of trauma survivors. Trauma manifests itself differently in each person and can be tricky to spot even by trained individuals. An uninformed provider might misattribute poor behavior or enhanced emotional levels in a child to ADHD or an adolescent acting out to just being a teenager, whereas a trained provider might recognize these as trauma indicators. And last but not least, it is important to recognize trauma-informed care as being applicable to everyone. Whether you are in healthcare, plan to go into healthcare, or are doing something else, understanding trauma-informed healthcare enables you to better help those around you. Thank you.